My name is Simon Horton, a lecturer at the School of Health Sciences, and along with colleagues at the University of East Anglia, I have been looking at patients' active involvement in neuro-rehabilitation. In the UK each year, around 350,000 people are admitted to hospital with some form of brain injury, a stroke or trauma, and many have a period of rehabilitation. Clinical guidelines and practice standards recommend the early active involvement of patients in the rehabilitation process. Most approaches to the study of active participation focus on individualized explanations of patient choice and behavior, or supposedly inherent traits such as motivation. But these fail to show how active participation is practically enacted. Neuro-rehabilitation is messy, embedded in buildings and spaces where individuals and objects interact. In this paper, we tackle the question of how to describe and understand the relational dynamics of the social and material components of neuro-rehabilitation. So, drawing on actor network theory as a sensitizing concept, we work through video data of rehabilitation therapy as day-to-day practice and examine the collective work entailed in shaping participation. We ask how rights to knowledge and expertise are constructed, and we explore how a body may acclimatize and adjust within an order of participation and transformation. We found that a collective of human and non-human actors evolves as a patient relearns. The capacity to sense, act, and effect neural change is made possible as actors come together in heterogeneous networks, where connections are made and eventually produce stable performances. A patient may actively work to sustain associations that produce competence or expertise, while therapists are working to re-territorialize them as compliant within a professionally defined order. So a patient migrates between active and compliant, competent and incompetent as they're immersed in new practices of doing a body. Finally, a patient's body is divided and recomposed. Therapist and patient make continuous efforts and adjustments, drawing on hard and soft technologies in deconstructing the body. But then we see a transformation as connections with diverse entities afford a patient the capability and agency to test, experiment, and negotiate performances of doing a body. So we argue that neuro-rehabilitation may be understood as a set of collectives consisting of bodies, objects and technologies drawn together in and through the activities a patient does. Taking an actor network theory informed approach has helped build a critical and conditioned understanding of neuro-rehabilitation, where the distribution of work between human and non-human actors produces distinctive performances of active participation which take a particular character at any one time. This suggests that efforts to standardize approaches to assessment and intervention, or count and account for optimum defined therapy doses, may be misdirected. It also challenges any assumptions that active participation should and can be located in an individual. This position fails to acknowledge or accommodate the heterogeneous networks inherent in producing active participation. Thank you very much for your interest in this paper, and we would welcome any comments you may have.